welcome to Talking Mental Health, a new podcast from the Wellness Project, where I, your host, interview mental health professionals in the mental health and wellness field on all topics, specifically as they relate to college-aged young adults. I'm here today with Lori. Lori, would you mind introducing yourself to everyone?
Hi, everybody. I'm Lori Osachy. I'm a licensed clinical social worker, and I'm owner-director of the Body Image Counseling Center in Jacksonville, Florida.
I'm very excited to have Lori here today. We're going to be talking um, eating disorders and body hatred. So I'm excited to kind of raise more awareness on this subject that we don't often talk about enough. So if you're ready, Lori, I'm going to go ahead and start in on some of my questions.
Absolutely.
Yeah. So first, I just want to know, what is an eating disorder? Can you define that for us?
There's a lot. I mean, there are definitely, I would say an eating disorder is an unhealthy relationship with eating in some way. And there are lots of different types of eating disorders and eating disorder behaviors.
Mm, yeah. And I was gonna ask, like, are there different types? And you kind of just said there's a lot of different types that go into it.
Right. So there's lots of different types. So many people have probably heard of anorexia nervosa,
Mhm.
which is when someone loses 25% or more of their natural body weight. They fear being fat, and there's all kinds of
Mhm.
symptoms associated with it, which I'm happy to talk about. Then there's also bulimia nervosa, which is when someone makes themselves purge in some way, either by throwing up or exercise purging, using laxatives in order to lose weight or get rid of food. And that has a different set of symptoms and ways of thinking as well. We
Mhm.
also have emotional eating or binge eating disorder, which is when people eat food beyond the point of hunger and usually gain weight as a result. We also have there are several kind of more recently identified eating disorders that have been very dangerous, even though they're not listed in the DSM-5R, which is our diagnostic manual. But one that has been very deadly is orthorexia, which is an obsession
Mm.
with clean eating, compulsive exercise, eating good foods and bad foods. And that's something we should definitely talk about, because I've seen a lot of students come in with orthorexic symptoms. And then you
Mhm.
have more feeding disorders, which are also, I think, part of the eating disorder family, which is ARFID, which is avoidant restrictive food intake disorder, which is what people might call picky eating, but it goes way beyond that. It's really an
Mm.
inability to eat a variety of foods, and people end up losing a lot of weight and presenting as anorexic when it's really not anorexia.
Mhm. Yeah, it's super interesting too because you're right. Those first few you mentioned, I have heard of just because of how common they are. But the other ones were not ones that I would have classified originally as, like, that's an
Mhm.
eating disorder. So it kind of opens your eyes a little bit to think about some of those possible symptoms. Um, yeah. So I am interested in some of the symptoms. Just I don't know which ones you want to go through, which symptoms you want to name, but if you don't mind speaking on that a little bit.
Sure, not at all. So for anorexia, definitely eating restrictive eating is the biggest symptom, and also a terror of getting fat or gaining weight. And it's, I would say, the most deadly of all the eating disorders, because the thinner someone with anorexia gets, the fatter they feel. And they often cannot see that they're getting thin. They think they're fatter.
Mm,
And so they often refuse help and are in denial about the illness. So there are physical symptoms of anorexia, which is, of course, losing a lot of weight, but you can have a lot of physical symptoms like losing your period if you're a woman, um, having all kinds of problems with the nutrients that you get, being malnourished, which can affect your organs. Um, Losing your personality, having trouble focusing, having trouble with relationships. Oftentimes, people with anorexia are so hungry and weak that they don't go out to eat with
mhm,
people. They are very isolated. It can be combined with compulsive exercising as well. So you can have the types mixed. So bulimia and anorexia can be diagnosed together. So
mm,
bulimia, the difference really there, besides the symptoms, is that people usually know that they have a problem and they don't tend to be restrictive. they're usually a normal weight, but what they're doing is they're eating food when they're not hungry, and then they're getting rid of it either by making themselves throw up or by taking laxatives or by compulsively exercising. So it's a little easier to treat just because the person knows they have a problem and usually want to get better.
Mhm.
Binge eating disorder or emotional eating, usually also people come for help with that because they don't want to continue to gain weight and to eat beyond hunger. It's uncomfortable and upsetting. And so they can have problems. They can end up purging as well if they keep emotionally eating. Just depends. Every person is different.
Mhm.
And then with orthorexia, that I think is besides anorexia the most insidious of the eating disorders because in my opinion, we can talk a little bit about this later if you'd like, is that I think our society is very orthorexic. We've our society and culture is very obsessed with clean eating. In fact, there was never a term called clean eating ever, years ago. That was invented. And all of
Mhm.
a sudden it is all over the place. And people think that it's healthy to eat clean, whatever that means. And what it usually means is eating a very limited number of foods that are deemed appropriate and also compulsively exercising. And that's part of this clean lifestyle. And what we're seeing a lot, especially in teenagers, is that they start by seeing, a video on YouTube or something that talks about how important and great it is to be a clean eater and to do these workout regimes. And they start and they lose a little bit of weight, but then they continue and they end up coming to us because they're malnourished and underweight.
Mm. Yeah, and actually, I mean, I would like to know more, I don't know if I'm gonna say it right. Can you say the last one one more time for me?
Orthorexia.
Yeah, orthorexia. I actually would like to know more about that, because I do think it's important to name those, like, societal influences on
Mhm.
that, and you touched on it a little bit. Could you expand just a little more?
Absolutely. So there were definitely eating disorders when I was growing up. You know, there was definitely anorexia and bulimia and all these things. I just don't think there was a name for it really, or people didn't know about
Mhm.
it. And there was definitely diet culture. I remember my teen magazines growing up had the grapefruit diet and all these crazy diets, but they were
Mhm.
called diets. They were to lose weight, which was bad enough. I'm not saying this was good. But the
Mhm.
problem with orthorexia is that it's put forth as a healthy lifestyle, and also there's a moral component to it that if you eat clean,
Mhm.
if you don't eat clean, you're eating dirty or you're eating wrong or there's something morally wrong with you, and the people that are eating clean are good or pure. And so that was not around when it was just diet culture. And so it's very confusing to people when they think they're doing the moral right thing that's going to make them live forever or going to make them good people, and it makes it much more difficult to get out of.
Mm. Yeah, I appreciate that too and the extra info on it because that wasn't really a side of, like, eating disorders that I had put together before, or had really heard of, and so I think that was a super important to name and expand on.
Mhm.
Um, I'd like to move forward a little bit and talk about some common causes, if there are common causes, and that can be super broad, but I also wanna touch a little bit on common causes for college-age young adults.
Well, college students, 25% of college age women will have an eating disorder, which is a very sobering statistic. It's a very
Mm,
vulnerable time for eating problems. So, the causes of that, there are a lot of causes. Well, there are certain indicators that make people more predisposed to developing eating disorders that have to
mm,
do sometimes with childhood trauma, that have to, and that doesn't have to be from your family. It can be that you moved a lot or you were in a severe accident or just some kind of trauma can predispose you. They found genetic markers for eating disorders. So those things you really can't control too much. But then when you're also born into a culture that's obsessed with dieting and being thin, so that does not help either. And then on
mm,
top of it, when you go to college, usually you're leaving home. Not everyone, some people live at home when they go to college, but even so, it's a big change. You're graduating from high school. For many people, they're leaving home for the first time and adulting for the first time. And eating disorders are made worse by stress, by stressors. And
mm.
so all of those things can come together in the college population for men and women to trigger eating problems.
Yeah, it sounds like, and you can definitely correct me if I'm wrong, that a lot of this is associated with, like, other, other types of past trauma or past mental health, issues or current of the both. They kind of, like, I don't know if comorbid's the right word or not, but they
Yes,
kind of
you
go
can
hand
have
in hand.
yes, you can have comorbidities, and you can definitely suffer from anxiety and depression and an eating disorder. Also, sometimes you can switch symptoms, so it's very common for someone who stops drinking to start binging and purging or vice
Mhm.
versa, because they're both very soothing behaviors, and if you don't deal with the root, you can switch your symptoms.
Mm. Yeah, so there's like a depending on kind of where it comes from, there's a replacement kind of
Yes,
that can
exactly,
go
if you
along
don't
with
get
it.
to the bottom of it.
Okay, yeah.
And we
Thank
know
you for
there's a lot of drinking problems in college as
mhm.
well.
Yeah. Wow, so we've kinda talked about causes with college age
Mhm.
young adults, but I'm curious too, how I don't know if this goes along the same lines or if this is a different question,
Mhm.
so I'm just gonna ask it.
You can
How are
ask
they
anything.
present among college age young adults? Like, is there any statistics on it
I'm
or
sorry, I didn't hear the first part.
yeah,
How
how are these how are eating disorders, body hatred, how is that present with college age young adults?
how does it present, you mean? Or how do they
Like,
ho
I know, I realized I didn't ask this question correctly.
That's okay.
So, like, we know that that some college age young adults do suffer from eating disorders. So I'm curious, like, do you have any statistics on, like, the prevalence, I guess?
Well, I right, well, a quarter of women will have an eating
Yeah.
disorder. I don't know offhand the percentage of men, but I'm sure it's high. Definitely athletes are more prone college athletes are more prone to eating disorders. I don't have particular statistics,
Mhm.
in front of me right now, but we could definitely look them up in 2 seconds. It's not
Yeah.
low.
Yeah. No, and I appreciate that too. I realized that question was kind of a weird way to ask it.
No, it's okay. No problem.
Um, so as soon as I said it, I was like, "Oh, interesting." Yeah, so then I guess my next question would be, what are some common treatments? Because I feel like the a harder step for people is once they're aware of it, is taking that step towards treatment, because it's so unknown. What's gonna happen to me when I go into treatment?
Absolutely, and it's difficult sometimes to find treatment and the right treatment. I've had people come to us who have said, I've been in treatment with a therapist for 8 months and I'm still purging," and they just don't
Mm,
talk to me about it. And that happens more than you would imagine. So it's very important to find someone who's a specialist so your symptoms don't get worse and you don't waste time.
mhm,
But the best form of treatment is what we call a team treatment approach, where
mhm,
you would be seeing a therapist and a nutritionist that work together with your doctor and maybe a psychiatrist if necessary to help develop a team plan to help you get better. And it's important to research the credentials of the people that you're looking for help. Now, the good news is that many college counseling centers do have treatment teams that treat eating disorders because it's so prevalent. So I
mm.
think the first place to stop is your college counseling center for help.
Yeah, we've actually talked, in a previous episode too about how to access those, counseling centers,
Mhm,
and I wasn't aware that they'd have those kinds of resources, so that's very, very good to know.
mhm,
Um, oh my goodness, I had a question and it's gone. Oh,
mhm.
so you mentioned that team of people, is this typically inpatient, outpatient, both, depending on, what the needs of the client at that moment?
Yes, it depends on the needs of the client. Our practice tries to use the least invasive form of treatment as possible. So we do an
Mm.
assessment, and if the person is not stable enough to be in outpatient treatment, we refer to inpatient. So we all kind of work together in the community, hopefully, to make sure that the person gets the right setting for treatment.
Yeah, thank you.
Mhm.
Um, Another thing too that I typically ask when it comes to just mental health in college age young adults is how does a peer offer support? Because I feel like we get into these instances so often when we're witnessing these things happening and we have no idea what to do.
Oh,
We don't
right.
have any proper training or we just
Mhm.
know it's happening and we're worried but don't know how to take the next step or what the next step even is.
Yeah, that's a great question, and it can be very, upsetting when you have a friend that's dropping weight and you can see the signs of them starving themselves, and you try to tell them, or you're afraid if you tell them they won't be your friend or they'll pull away from you,
Mhm.
or you're afraid you'll say the wrong thing and make it worse. It's very,
Yeah.
very difficult, and especially even if someone's purging, you hear them purging in the bathroom or, it's very difficult, like, "What do I do? What's my place?" And
Mhm.
what I would say is that the best thing to do, I mean, you should always, I think, always tell somebody that I think you need help because they're deadly illnesses, and
Mhm.
even if you lose the friendship over it, at least you tried to save their lives, and you can look back and say
Mhm.
you did the right thing. Especially with anorexia, they are not usually going to get help themselves until they have a physical complication and are forced to get help. But the
Mhm.
best way to go about it is to go to your friend and to tell them the physical or tangible signs that you see so they can't really deny it. You
Mhm.
can't say, are you restricting your food? And they say, no, I'm eating fine. I mean,
Mhm.
people come into us and they say that. And what we
Mhm.
do is we say, "Oh, tell us what you eat in a typical day." And they tell us, and it's like a carrot and a cracker, and they think that that's fine, or they're not telling the truth,
Mhm.
because they don't want to go to treatment. So what you can do is you can say, "These are the things that I've noticed. I care about you. I'm worried about you. And these are the things that I've noticed." So you can say, "It seems that you have dropped a lot of weight very quickly. You're not yourself. You're having trouble concentrating. You've dropped out of these classes because you haven't been able to go. You haven't been able to concentrate. You haven't been coming with us to social events, and you've been isolating." So you kind of list the physical things the measurable signs that you can see, and then
Mhm.
you want to have some referrals, with you. The counseling center has an eating disorder treatment team. They have counselors there. Would you consider going? I found out you just have to call this number to set up an assessment. And then, you know, the other thing is if they do get angry or they say, I don't have a problem, you've at least planted a seed and you can, try again. You don't want to keep at them and, make them just totally cut off from you, but you can go try it again in a few weeks gently and tell them again what you've seen.
Mhm. So is that, just kind of raising awareness within themselves, helping them be aware of what is going on kind of stuff?
I think, yes, definitely. Sometimes it's almost like someone has to wake you up and say, this is not right.
Mm,
This is not, because you get so caught up in the dieting and thinking it's a good thing and you feel good losing weight. And so you feel like you're doing the right thing. And it almost takes someone to kind of shake you and say, no, this is dangerous.
mm.
And also to know that someone cares about you and that they care about your well-being and help is available. Sometimes that does help.
Yeah, and then, because you did mention getting like, having referrals ready,
Mhm.
in the case that they are like, "Yeah, okay, I'll go and get help." Um, how would a peer access that? Is it just through the counseling center at their college, they can find resources there, or is it?
I would say that's a great first stop. You can also
Mm,
research treatment online. There are websites where you can go, and there's one called edreferral.com where you can click on your state and your city, and they'll list therapists that treat eating disorders and nutritionists, and you can get a list for them there. You can also, if you know what their health insurance is, they can call the health insurance and ask for specialists that are covered under
mhm.
that insurance that treat eating disorders. So those are good places to start.
Yeah. Um, it's interesting because I'm looking at my list of questions while we're talking,
Mhm.
and I honestly, going into this, did not know a lot about eating disorders. I know those few names of them. I know
Yeah.
kind of what they look like, but not a lot about them. So I'm looking at my questions, trying to find places like, does this fit in? Is this a question that actually applies to this type of mental illness? And so I'm going to ask this question, but it might sound a little weird.
You can
But
ask anything you want, and I'm sure I can make it apply.
That's what and it's something that coping skills. I talk about coping skills all the time, just what can help with certain things. And so I'm curious, are there applicable coping skills when it comes to eating disorders, or are those things that help with like other underlying causes?
Well, the best coping skill when you have an eating disorder is to get help, qualified
Mm,
help. And then when you're in the therapy, the therapist and the nutritionist give you very powerful coping skills to help you recover. So that can range from having a meal plan that is healthy for you and the nutritionist supports you to eat, to get over the fear of eating it, which is not easy. It can be medication. If you're so anxious you can't eat, sometimes medication can help. And there have definitely been medications that help eating disorders get better. And they're a very powerful tool in recovery. And then there's also coping mechanisms that are not medicine. So, for example, talking about the things that are stressing you out. Usually there's a trigger for eating disorders, and the pressure and stress of college is a big trigger. Or
Mhm.
maybe there was a relationship that broke up and you need to talk about it and learn how to deal with it. Just talking about your problems is a big coping mechanism.
Yeah. Well, thank you so much. That's the end of my questions. So, I have very much, I don't know if enjoyed the right word was the right word, but I feel very informed on a
Oh,
subject
good.
that I didn't know a lot about. And so I'm hoping that this will help other people who are unaware of what eating disorders are, other than just, anorexia, bulimia. We don't know much past that.
Mhm.
So I'm very appreciative of you being here today. And thank you so much for helping
I
us.
would just, if you wouldn't mind, if I could just
Yeah,
add one more thing,
yeah, go
because
for it.
one thing we did not talk about was negative body image.
Hmm.
And I just want to make sure that I say a little something about that, because I think that we live in an eating disorder culture that is obsessed with body image, and it especially affects young women. And
Hmm.
so if you do not have an eating disorder that's defined, by a doctor, it doesn't mean that a negative body image is not destructive. And
Yeah.
so it's very important to know that you can get help for negative body image too, and you don't have to live with it. That therapists can help with that too, and you don't have to be purging and starving to get help for negative body image as well.
Yeah, I appreciate you adding that because that's
Mhm.
just another thing that within this whole world that I hadn't thought about that before. If you don't mind me asking about that a little more,
Not at all, not at all.
what does getting help for that look like? Is that just going to therapy?
I think therapy can help a lot. Again, there are triggers for negative body image that can be
Mhm,
personal. So, for example, if you've had a trauma like a breakup, or you failed an exam, or you failed a course, or you don't know what you want to do with your life and your parents are on your back about picking a major. Not that I'm
mhm,
trying to throw parents under the bus. Parents are usually great, but it can trigger negative body image. Sometimes we can feel bad about ourselves when it's really not about that. So a therapist can definitely help you figure out the triggers when you have bad body image days. But on top of that, I think we really need to become more critical of our society, and especially social media. There was a study
mhm,
that just showed that 95% of young women that are on Instagram have negative body image. And if you spend 5 minutes on Instagram, you can see why.
mhm,
It's all about posing your body and using filters and really kind of saying you're not okay the way you are. And
mhm,
so I think as a society, we need to start to get more angry about that and
mhm,
stand up to that and refuse to buy into that culture. But it's a tall order, and men and boys are not immune either. They
mhm,
have eating disorders and they have negative body image too, and we can't forget about them.
mhm. Yeah, it's so important too that you mentioned social media because I mean, it's like speaking the language of college age young adults is being on social media. There's actually, I can't think of her name right now. I was trying to remember it, but I follow an influencer on Instagram who debunks all of that. She's like,
Yes.
this is how influencers pose for a mirror. This is what I really look like in the mirror. This is
Yes.
how they style this outfit to look like they're
Mhm.
smaller. This is really what it looks like. So, and I think that more of that needs to be present of like debunking all of those.
I agree with you, and I'm glad those people are out there and they're becoming more numerous for sure.
Mhm. Yeah, well, definitely thank you for adding that on. Definitely stop me anytime because the more information we can get on these subjects, the better to help raise awareness and to talk about it. So, thank you so much for being here. I'm
You're
very
welcome.
excited to see this go through.
Thank you for having me.